Aloha, welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper, and today I'm going to demonstrate a scapular rotation exercise that will activate the lower and middle tract. This exercise can be used to help re-educate the lower and middle tract to stabilize the scapula or shoulder blade during overhead movement. The most common dysfunctional pattern seen when evaluating a shoulder is when the upper tract fires early, inhibiting the lower and middle tract, preventing them from stabilizing the scapula or shoulder blade when performing overhead movements. When conducting abduction or flexion, the motion should hinge at the shoulder joint for the first 60 degrees and not at the base of the neck where it meets the shoulder complex. After the first 60 degrees, the movement should then hinge at the base of the neck where it meets the shoulder complex, elevating the shoulder joint overhead while rotating the medial border down or inferior. So again, first 60 degrees hinges at the shoulder joint. After 60 degrees, the motion should then hinge at the base of the neck where it meets the shoulder complex, elevating the shoulder joint overhead as the scapula rotates downward. Now, if the upper tract fires early, what you'll end up with is shoulder elevation without scapular rotation, right? And you'll see how that limits the range of motion of where the shoulder blade actually ends its range of motion, prevents the rest of the shoulder from moving overhead. So this exercise is designed to restore scapular rotation. First progression of this exercise, I'm going to use a wall variation that will allow me to cue posterior pelvic rotation with lumbar stabilization and scapular retraction. So I'm going to start with my feet about 1.5 feet away from the wall and approximately shoulder width apart. I'm going to initiate a posterior pelvic rotation through bilateral glute max contraction while simultaneously contracting the deep abdominal muscles. So I'm going to do that by retracting my belly button towards my lumbar spine. From there, I'm going to slightly elevate the shoulder blades and retract them so that the medial borders are in contact with the wall. So now my shoulder blades and my lumbar spine are in contact with the wall, providing a flat neutral spine. So from this position, I'm going to start with the arm in neutral position. So I'm trying to line the elbow up with the shoulder and have that parallel to the torso. From there, I'm going to start with shoulder flexion, and I'm going to bring the shoulder forward, and at 60 degrees, I'm going to try to pull the shoulder blade downward or rotate the shoulder blade downward by activating that lower and middle tract and moving the shoulder joint overhead. So at the top position, I'm going to pause for a couple of seconds and then bring the arm back down to just about 60 degrees. So from here, I'm going to bring the arm back up, and again, I'm trying to activate the lower and middle tract and pull the shoulder or rotate the shoulder blade down. So again, pause for 1 to 2 seconds and then back down to approximately 60 degrees. So I recommend doing the flexion version of this exercise until you master the movement before moving to the abduction portion of this exercise. For me, it seemed like it was easier to activate and retrain the lower and middle tract through flexion before moving to abduction. So again, for the first rep, I'm going to start with the arm in about a neutral position, then abduct the arm to just about 60 degrees, and then I'm going to activate the lower and middle tract, trying to pull or rotate the shoulder blade down or inferior, bringing the shoulder joint overhead. So again, pause for 1 to 2 seconds, and then bring the arm back down to about 60 degrees, and then perform the next rep from that position. So again, trying to pull the shoulder blade and rotate it downward, and then back in. For the second and final progression of this exercise, we are going to use a resistance band to provide light to moderate resistance. Again, I recommend trying to master this movement through shoulder flexion first before moving on to shoulder abduction. So again, I'm going to use a wall variation, which allows me to cue my posterior pelvic rotation with lumbar stabilization and scapular retraction. So I'm going to start again with the arm in the neutral position for the first repetition, and then I'm going to flex the shoulder to approximately 60 degrees, and then from 60 degrees I'm going to pull the shoulder blade down, rotating it and elevating the shoulder blade overhead. I'm going to come back down to approximately 60 degrees, and again I'm going to activate the lower and middle trap to rotate the shoulder blade. The abduction variation will be the same, so the first repetition starts at neutral, abducting to approximately 60 degrees, and then using the lower and middle trap to rotate the scapula. Return to approximately 60 degrees, and then again activating lower middle trap to rotate the scapula.